Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. Today, we're joined by Dr. Maie St. for what promises to be an incredibly insightful conversation. Before we dive in, I want to give you a quick heads up. We experienced some technical difficulties during the first 10 minutes of our recording, but we got everything sorted out from that point forward. So please stick with us through those initial few minutes, because the content that Dr. St. shares is absolutely worth it. Her expertise and perspectives on the field are truly valuable, and I promise you won't want to miss what she has to say. Let's jump into it. I'm so excited to host this video cast with Dr. Maie St. Maie, welcome.
Thank you so much. It's my privilege to be here. Really excited to be with you, and congratulations to you on everything you've done.
Oh, that's so kind. You turned the podcast right back into me. Congratulations to you. I shouldn't say I think, because I know one of the highlights of my job is meeting amazing members. And I got to meet you at SUO when we were on a panel together, and I've continued to research you, read your works. You are so impressive. I don't know how you answer that, but I'm just making a statement.
No, I think what I would really like to say is a lot of people say nice things to me, and I have to say that I am only who I am because of my team and because of the people who believe in me, uplift me, support me, and the people who really make the magic happen. And that's not me. I'm just one person, one voice of a team of incredible.
Well, our goal with Voices of Otolaryngology is to take your one voice and amplify it. And I have no idea where this is going. We haven't prepped, we haven't rehearsed, but I guarantee you we will inspire or mentor a future Maie St. So how did you get started? How did you become a world-renowned head and neck surgeon, cancer researcher, starting from where? Where'd you grow up?
I was actually born in Wisconsin, then I was raised in Texas and North Wisconsin when I was one. Raised in Dallas and Houston, and my parents moved to Los Angeles when I was in third grade. A little bit of kind of back and forth between Texas and California. And then actually I went to Stanford undergrad. It was not something planned. My father had wanted me to stay in Los Angeles, go to Caltech. But when I got accepted, my father decided I should go to Stanford.
So I just got chills with that. That's most family table discussions. Dear daughter, Stanford or Caltech? So obviously you're brilliant.
No.
What was your major?
It was a long time ago. It was easy to get in back then. Those things have changed.
What was your major at Stanford, and then how did you progress through residency?
So I actually majored in biology at Stanford, but I also minored in physics and English. And actually, the story is that when I was doing my research my junior and senior year at Stanford, PI came up to me and said, Maie, I turned 78 this year. Why don't you stay on and be an MD-PhD, my last MD-PhD student? I'd never heard of the NSTP program, Medical Scientist Training Program. I called my parents. It was pre-internet days at Shah. So basically, my parents were like, what is this? I said, well, they pay you $12,500 a year and they cover your med school costs. My dad said, that's a winner program. Let's go for it. So that's when I applied. And then at that time, I had to decide whether to go to the East Coast or stay at Stanford. And my husband was my fiance at the time. We got married pretty young. And we thought to stay at Stanford. But I got advice. People said, if you want to come back to California, go East, variegate your portfolio, and come on back. So that's what I did.
And so where did you go?
I went to Yale. I did my medical science training program at Yale. And I have to say, the environment, the curriculum, the autonomy, the independence, the accountability, and education. And I credit my PhD mentor, who's now, he was Howard Hughes at the time, basically was teaching me how to think critically, how to write well, and how to speak in podium.
Has he passed or he's still around?
No, he's still with us. And he actually is vice president of the first private university in China now. He is from China, called Westlake University. I had the privilege of speaking there last month. And then he came out and spoke here. And believe it or not, he now wants to come back to the United States and work in my department. So we can build a really great platform looking at AI and how it may change clinical trials.
You broke up there a bit. You said he wants to come back and work
in my department, work with me in my department.
Okay, so you're going to hire your mentor.
I look at it as I'm going to partner with him. He is incredible. He's the type of person who, so currently he is working on, we want to work together on looking at longevity, reversing pulmonary fibrosis, hearing loss, sarcopenia, all the kind of aging signs. And we have done that in the animal model, and his lab really is a leader in that. And now he's also cataloging and developing AI called Deep Nature to look at the mechanisms behind Chinese herbal medicines. So we can actually think about it. So it's very exciting thinking about kind of lifting platforms. He and I would combine my research and his research in what I would call transformational, translational impact for patients.
Can you say that one more time? Transformational, translational impact for patients.
Yeah.
Okay. I always look for catchy titles. That's going to be the title of this one. It just really rolls off the tongue. I'm kidding, but it's really important. Transformational, translational impact for patients.
Yes.
Wow. So one reason I took my job, since you asked, is to push innovation. So mark our words, because this will be forever memorialized. When you spin off, let the Academy invest with you, or think of a way that the Academy and our members can win. If that doesn't happen, let me invest. Okay. I'll invest with you, Dr. St. John, any day.
Oh my goodness. Well, I will invest in you, Dr. Shah, and we are so grateful for your investment in the future of our specialty in the Academy. Really.
Thank you. So back to so you went to Yale, and then take us through your residency and talk a little bit. It's just absolutely amazing. You got the research bug early on, but that bug is amazing, and it's blossomed into a premier surgeon scientist. Talk to me through residency. Did you get to do your research? It ain't easy, and you went somewhere for residency. Where did you go for residency?
So I went to UCLA for residency, but I'm going to back it up just a little bit to because I'm very passionate about the surgeon scientist model. And I think a lot of trainees come to me and say, how can I be a surgeon and how can I do research? And what I want to mention is I was very fortunate to have been kind of told about the MD-PhD program by my initial mentor. But the issue is you always have to think about Louis Pasteur, chance favors the prepared mind. When you hear something like that, you follow up on it, you look into it and see if it's for you. Don't just let those opportunities pass. When I went to medical school, I did my 6 weeks of internal medicine rotation prior to going into the laboratory. That way I could work a free clinic once a week. However, when I did internal medicine, I did not care for that. And I called my father one night saying, I can't believe I've spent my whole life getting ready to do oncology or medicine. And now that I can't do it, I don't care for it. It was too conversational and too little time with patients, in my opinion, that rotation. So my father said, do me a favor and finish. I went into the laboratory, and in the lab, I got to work on animal models doing surgery. And I found that when I injected a Drosophila egg with minute amounts of RNA, that I was very interested in using my hands to cure cancer. And that's what led me to think about otolaryngology and surgery with the amazing mentor, may he rest in peace, Clarence Sasaki, who really kind of took me under his wing for my entire career, actually, I have to say. I've been incredibly supported by my mentors, people who taught me to put the patient at the center and everything else takes care of itself. So I got very excited about thinking about how to shape and transform what we do surgically. When it came time to apply for residency, I only applied to 5 programs, all in California. So I wanted to come back. My husband and I are both in California. So people told me that was a bit of a gamble, but I felt that, hey, then, and actually I should tell you a very cute vignette, which is when I came to do my sub-internship at UCLA, I called, they said, we have certain dates available. I showed up, all the faculty were here working. And then a day later, they all disappeared. And where did they go? They all went to the Academy meeting, leaving me and one little crew of residents behind. And so my sub-I, where I was supposed to meet people, was kind of me and a small crew of residents. However, the way life works, these residents told the faculty, this woman helped us so much, we must take her. So things sometimes don't look like they're going to work out, but they always work out if you put your heart and mind into it and you're doing it for the right reasons.
May I? You've mentioned your father a few times. Looks like he's an early mentor.
Yes, my father has a PhD in electrical engineering from Wisconsin, and then he got an MBA, and he actually worked in finance for many years until he retired. My father has a Germanic ancestry, and so he has a bit of that kind of, well, you're going to do this, you're going to do that, you're not going to do that, continues to give me amazing advice. My grandfather was my initial mentor because he was a small town physician in Egypt. I would spend my summers there, and he would carry me on his shoulders. He was a very tall man as we saw patients. And Dr. Shah, I remember one afternoon, we saw a woman with a very large growth on her face. And I was about 5, 6 years old, and I asked my grandfather, what is that? And he said, that is cancer. And from that age, I had no idea, of course, what cancer was, but I thought to myself, this is what I'm going to do. I want to help people with this and I want to end this. And that really drove me and continues to drive me in my career today.
That's amazing. So during residency, were you able to do research? How did you balance that out? And then take me to staying on as faculty as assistant professor.
At the time I did residency, it was a 6-year program at UCLA, 5 residents per year. And I actually, they did this thing where if you did well on your in-service, they would ask you if you wanted 6 to 12 months of research. So I did a full year of research and postdoc during my residency. And during that time, I wrote my K award. And that K award got funded when I was a 3rd-year resident. And I think I might have shared with you a vignette. There's a little bit of a vignette about the K award when I finished my residency. And also, to be honest with you, during my 3rd-year residency, the chair at the time who hired me, Jerry Burke, offered me a job. He said, "We like you. We'd like you to stay here. So why don't you just stay here?" So I really didn't consider moving when I stayed on. I did a postdoc during that time, 6-year program. And when I became faculty, the laboratory where I had gotten funded had kind of shifted into doing breast cancer. So I had to really think long and hard. And that mentor said to me I had to return my K award if I didn't want to pivot into breast cancer. So I ended up returning it, doing 3 mini postdocs in the first year of faculty. Once again, when one door closes, please run through every window, find what you want to do, find your voice. And I was able to get the K refunded and then continued on with all the funding.
Dr. St. John, we transitioned from your dynamic image to your phone. I'm sorry about that. We are having technical difficulties on the Academy side, but I want to make sure members can hear you loud and clear. K was refunded. What was that K award at that time as you transitioned to a junior faculty member?
So when I transitioned to becoming a junior faculty member, that was when I had my original K, and then I went back to the lab where I'd written the K, and that PI had moved on to doing breast cancer and commented that breast cancer was like a 747 in the sky, and head and neck cancer at the time was like a beat up 1967 Honda Civic. But then I had to come to terms and tell him that I was driving that Honda. So during my first year of faculty, I actually ended up only operating at our county hospital, did not set up a practice at UCLA main campus. And then I was teaching residents and doing many cases, but then I was also doing 3 mini postdocs while I rewrote a different K award that got funded at the end of that year.
And that was on head and neck.
And that was definitely in head and neck, looking at what is called the epithelial to mesenchymal transition. Basically has a lot to do similarly with when an embryo implants into the placenta and looking at the morphologic change that occurs in the cells. We do know that the more epithelial phenotype cells respond better to treatment, whether it be surgery, radiation, medication. And so there's an interest in understanding how we can drive cancers to becoming less aggressive and more responsive to therapy.
So, Maie, in my simplistic fashion, has your career been to drive aggressive cancers to this epithelial variant that it's more amenable to treatment?
So that was, I would say, the kind of early portion, my K award. And I transitioned from that really to focusing on the confluence of biomedical engineering, which is my undergraduate background, with surgery and how I could think about that niche. And to be honest with you, a lot of the ideas that we worked on were brought to us by patients. So, for example, about 8 years ago, I had a 32-year-old woman come to my office with her husband, and she had been diagnosed with tongue cancer, and they had had the opportunity to speak to many people all around the world about the next best step. And her husband asked me 2 very salient questions. He said, number 1, Dr. St. John, how much of my wife's tongue are you going to take? Because we do have young children at home. And number 2, he said, when you come out of surgery and tell me that everything went well, how will you in fact know that we have removed all of the cancer from her body? So I knew the standard of care answers that I would give a patient, and I knew that all of my colleagues could do. But I thought to myself, when my car gets near something and beeps, it's because it's a different density. And when I'm resecting a tumor, in addition to clinically observing the tumor, I am palpating the entire time. So I thought, why can't I work with the biomedical engineers here, and given my background, to create a system where I can see cancer intraoperatively in the operating room for precision surgery? And that's how that was born. We also are working on polymer delivery systems that we can place into the surgical bed, because I know when I'm resecting a tumor where it rolls off and where it's stuck. Why can't I put a polymer there that could really guide radiation to high dose therapy, place gold nanoparticles in it to allow us to give less radiation to patients, to allow them to have fewer side effects, and also retain it as a modality for treatment down the line? Why can't we deliver directly to the tumor area instead of giving systemic therapy? These are the kinds of things that come to me from my patients. And then we're able to create a team to offer solutions to think the way we shape and practice otolaryngology head and neck surgery.
And more importantly, or not more importantly, but perhaps for your career, you've been able to obtain funding to test these hypotheses.
Yes, that is true. And, I've had many mentors who said to me, Maie, you just need to kind of tell yourself that you can land on the moon. I think one of the things that happens as I mentor junior faculty is, you come to the operating room, you've trained in it, you do the surgery, you come out, things went well, the patients are saying thank you. And then you submit a grant, and a few people you don't know send it back to you and say, this will never fly. They come to me and say, well, I'm clearly good at one thing and I'm not good at the other. And what I have to teach people is continue to follow your passion, continue to solve, because if you don't solve these questions, who will? You have an absolute insight into what the problems are. And the truth of the matter is, for every 10 grants you're going to submit, you'll get one. So it's a different metric than the way that we are kind of trained to do surgery and be successful, 99% of the time.
Is that your batting average, about 10%?
Oh, my batting average is probably 1 in 100 or something like that. But
Are
I
you
have
serious?
tenacity.
Is that true?
No, I don't know. It's probably not that low. But my point is that, it's not going to be, sometimes, you'll submit something and you'll get a score. Sometimes you'll submit something and it won't be discussed. We just submitted something as a team at UCLA and it wasn't discussed. But that's okay. Okay, that's fine. We will adjust and try again. Because if you have to believe in it, that fire, that passion to shape and change has to be inside you. Nobody should be able to take that away. But also, you have to find your own voice and confidence inside to say, I want to do this. And if you find something true where they say, for example, this would be great, but you really need somebody who is an expert at single cell sequencing on your team, then get that and make it happen. Some of the things that they tell you may be quite helpful. Some of the things may be uninformed, but that's the way the process works. But if you don't keep trying, it will never happen. I tell my children all the time, the best way to ensure you don't get something is that you don't apply.
I adopt the same philosophy at the academy. Indeed, earlier this morning, I was talking to one of our leaders that I want them to fail, fail, fail. It is okay, because we will get a base hit. We will get a grand slam as we test our hypotheses. So very similar business approach I take as you. So if we look
Yes.
forward from what you've done, if you can give me the next decade in the St. John lab, and you probably have a proper name for your lab, or it's
No,
called Mae's Lab. Yeah, give me the name of the lab, but then also, what do you see out there in the next decade?
So it's really funny because most people I work with call me St. John. That's just the way they call me. People don't call me Maie. So when somebody says Maie to me, I'm like, oh no, I'm in trouble. Like when people would use your middle name as a child. So yeah, we just call it the St. John Lab. I think really the next decade is going to be, how can we continue to improve our knowledge of things like AI that are coming on board? I have a mild understanding of AI, I would call it. I'm actually going to take a course because I think it's important for us to really get the tools, just like in surgery, to understand what the capacity is and how one can use it. So, as I mentioned to you, we really want to I want to work with my mentor, Tian Shu is his name, XU. I really want to think about how we can use AI to predict by looking at the structure of certain drugs and then looking at the mutational structure, which drugs may actually be best for a patient. And that may change the landscape of clinical trials, Dr. Shah, as to what we're offering patients. I also think using polymer science to deliver things in the local microenvironment for patients, in addition to then being able to query that microenvironment. If we look at an animal model, for example, another thing we are working on is thinking about patients with immunosuppression. So those patients, if you have a transplant, you have a greater than 50% chance of developing an advanced skin cancer. If you have a double transplant, it's almost 100%. So now we have to think about the era of why do we need to have total systemic body immunosuppression? Could we create immunocompromised islands using polymer therapy in patients who are immunosuppressed? So I'm very excited about the future. I think, for example, cochlear implantation, they're going to get smaller, faster. They're going to be able to translate for you at the same time that you're taking in the information. People who've had a laryngectomy, we can retain their current or prior voice if there's audio to continue to allow them to have that personal touch in speaking. These are things I'm really excited about, and I'm excited to be part of the next decade and very fortunate to have collaborators all around the globe who believe in making things better for our patients.
You have a strong interest in AI. If you ask my friends, my coworkers, my peers, our employees at the Academy, I'm absolutely obsessed with AI. I was reading a book a week about AI, now probably down to about a book a month, but your academy is also embracing AI, not just with staff, not just in our workflow, but externally facing. So there's some pretty exciting stuff coming around the corner where our academy will be the forefront. So I'm glad that we're together.
Amazing.
Yeah, I'm glad we're together because amazingly we can think how we partner to take the next leap. So wonderful answer. It's on LinkedIn, so I don't need to say anything, but your time and tenure was remarkably low. You were 11 years before you became a full professor. If I could add 6 plus 5, is that right?
That's exactly right. Yes.
Yeah. So amazing. Can you tell everybody the endowed chair that you sit in and the significance of that chair?
Yes. So Dr. Thomas Calcaterra is one of the giants. And when I say if I have seen further, it is because I stand upon the shoulders of giants. He and his wife, Ellen Calcaterra, really kind of developed and grew the department here with other leaders. He was a head and neck cancer surgeon, EL parallel. I had the opportunity to work with him for 1 year when I was a second year resident before he stepped down clinically. But over time, they had given an endowed chair for the next chair of otolaryngology head and neck surgery after Dr. Brooks' tenure, and when he wanted to step down. So Dr. Calcaterra bestowed the chair upon me. I think it was in 2018. He gave a very moving speech. He had become more advanced in years and said that he would know that this was going to be the last person that he would formally hand the chair to. Unfortunately, he did pass away in 2021. His wife and I continue to meet regularly, and his legacy has touched every aspect of this department and too many lives to mention on this podcast.
Do you carry that burden? Sometimes you think about it, it's an honor, and you ask, am I stewarding the department in the right way? Am I making the right decisions?
I think early on in my tenure as chair, I thought a lot to myself about, how do you steer the Titanic? How do you know what the waters are like? But over time, I have been able to really kind of work with my team and do my best to inspire them. So I don't have to make any decisions in a vacuum. I can reach out to people and we can think critically. Some things are time sensitive, just like in surgery, and you have to make a decision. And some things you have the luxury of time to think about it. And then there's always on ramps and off ramps. And so I really feel that COVID, when that hit, I'd been chair for under 2 years. It really actually, in retrospect, was a time where I set up Zoom calls every morning, every afternoon with faculty and with residents every evening. So we could talk about the information, talk about the narrative. And I think at that time, I was able to really kind of find my voice because the way I approach it is I am here to care for the department. The department is my patient. I want our department to be where every trainee wants to come because they know that we are going to be here to uplift their careers and make every connection for them that we can, and where every faculty wants to spend their career because we want them to reach their goals. For everybody to reach their goal, I mean, that's what happens. Like the rising tide lifts all boats. We get to shine. And Dr. Shah, when I applied to be chair in 2017, I wrote in my LOU, I went back and looked at it recently, that I wanted to take the department to number one. And at the time, I didn't know if that was ever going to be possible because no department at UCLA has ever been ranked number one by US News and World Report. Until this last year, we were ranked number one. And when they called me and told me I was in clinic, I actually started crying because I know how much work went into it, not by me, but by everybody on our team, everybody, the people who help us make appointments, the people who call patients back with, hey, your MRI is at this time. That's how the magic works. When people feel you are caring for them with every ounce of your soul, your heart, and your training.
Well, thank you for that. I want to rattle off I have four more questions, so I will keep our momentum going. You made a conscious decision early in your career to prioritize a surgeon scientist or scientific inquiry. You told me early on you were at the county hospital and you balanced your time. Can you talk very briefly about that decision and where you are now clinically versus administrative versus surgeon scientist, how that time balance looks like?
When I first started my career, and I actually should kind of embed a little bit about my family. I am a mother of three sons. So I had my first son during my third year of residency, and I got 2 weeks maternity leave after a C-section at that time, which was a very trying process. And, for another day or another lecture or panel, I can share how during that time I thought a lot about leaving medicine because I was trying to heal myself after a surgery. I was trying to decide why I would be running around all night caring for people who I'd never met and then bringing somebody in to care for my own son. So those are things I had to kind of grapple with early on. But when I started my faculty appointment, a month into it, I had my second son. And so I was at the county. And at the time, my mentors had said, it's great to be at this county hospital because you will then be able to learn to operate really independently, learn to do all things, and practice that. And then at the same time, it freed me up from having to kind of do a lot of patient phone calls and patient pre-prep. I would just go there, teach the residents, see clinic patients, and operate. So it really afforded me the time to do these mini postdocs and rewrite my K award. I actually ended up 2 years later, they asked me to be the division chief at the county. And at first I said, wait, I'm only 2 years out. But the chair of surgery at the time, who was another fantastic mentor of mine and passed away regrettably, said to me, Maie, you can do it and I'm here to support you. And that's really kind of the ethos of what's happened. People tell me, we believe in you, you can do it. And then I take it and I do my best. And I always have people to lean on. So for me, it was fantastic to be at the county because it afforded me time to think and grow my lab, to write a K award, and to think about what I could do. As time went on, in 2015, I'd served 9 years at the county as division chief. I then came back to UCLA full time and was able to really kind of build my practice. One of the things I very much believed in was a multidisciplinary model. It takes a village to care for these patients. And even if someone is not a surgical candidate or there aren't any standard of care treatments, we can always help people. If you take care of cancer, sometimes you win and sometimes you lose. But if you take care of people, you will always win. So for me, that's allowed me to continue building here at UCLA, practice with an amazing team, my co-surgeons, my medical oncologist, my radiation oncologist, my mind and body therapist, my pain specialist, my nutritionist, East West Medicine. We are here to serve our patients in every way we can.
So right now, what does your clinical administrative research time allocation look like in terms of percent?
So it really kind of
The reality,
varies.
not on
The
paper.
reality.
Reality.
Yeah, no, of course, I know. I mean, it varies. Some weeks I do 6 cases, some weeks I do 10 cases, some weeks I'm traveling. So it's really kind of an overtime kind of thing. But I would say it's about 40% clinical, about 30% admin, and about 30% research.
Yeah, it sounds about right. Sounds about right. And I know those numbers would easily add up to 100%. So I get that. Dr. Sarah Bowe, who's a mentor,
Yes.
peer, friend of all of ours, said something interesting in her podcast, and I think you're dancing around it. So I don't want to put her words into yours, but she said sometimes you just don't say no. If you've given an opportunity, you take it. And some of the wisdom out there is, oh, learn how to say no, learn how to say no. But it seems early on that you took some of those risks and opportunities when they came knocking. You didn't say no. And that when you were 2 years out at the county hospital, you didn't say no. You took that opportunity.
I think I agree with that. I do just want to kind of offer a little counterpoint, which is I remember when I first joined the faculty that one of the senior faculty contacted me and said, hey, I know you want to kind of grow your practice. So I'm going to ask you or give you the opportunity to take my call because then you'll get patients.
Yeah. No, that's an easy one, Maie. That's
Correct.
A big no.
I know, but I just want people to know because I want to tell you, there were people before me who said yes.
Yeah, right.
Okay?
Of course.
Because, of course, here's a senior person in your department. You don't want to be that person. So my point is, yes, you have to think about what the opportunity is. And I agree that when you're early on in your career, you need to say yes, but you need to follow up with yes with delivery, because it's worse to say yes and not deliver than to say no. So you have to really think about it. And every time you say yes, you cannot fool yourself. Something will come off the plate, whether you are aware of it or you're not aware of it.
Exactly.
Everything takes, you have to nurture everything. And I do just want to mention, because I mentioned my first two sons, I did have my third son 6 years into my faculty appointment. By that time, I had a 4-month maternity leave. So I do have my 3 sons, and they're obviously the biggest priority for me in terms of everything. So I think when we look at work, and I try to kind of mentor my junior faculty, I tell them work is a part of your life, but it doesn't define you. You have to really think about what you want, and nobody can tell you that. You have to define it.
You've made investments in yourself. You just said, in addition to all of your duties, you will take a course on AI. So you
Yes.
clearly believe in investing in yourself. Can you talk a little bit about that?
So I think the thing is that as we do things like operate, and now I've been fortunate enough to be operating as faculty for, 18 years. You get very facile and comfortable with several things. Of course, surgery always humbles you. You get in, you think you know where it's going to be stuck. It may or may not be stuck there. But I think the issue is, how do we continue to improve? And as the world changes, one must think about, how do I want to be part of this conversation? Am I going to be at table? And if I'm trying to say, hey, I want to help my patients, what can I do? And those are the kinds of things I invest in. What are my goals? What is it going to do for me? I also, the last 2.5, 3 years, have invested. I have a personal trainer, and I make those appointments, because without those appointments, there's so many things that compete. So I think, yes, I have to really think about what is important for me, what's important for my family, and what is important for my patients. And as I think about things that way, the priorities fall into place.
Yeah, I like that. I was going down the path of investing in yourself professionally, but personally,
Yes.
it's much perhaps more important.
Yes.
Yeah, very,
So,
very well said. Final, kind of as we start thinking about closing this, you wear a lot of hats in a lot of otolaryngology societies, and I have a feeling you wear a lot of hats outside of otolaryngology societies. Why do you participate in the academy? How do you juggle all those hats, your fiduciary duties, your duty of loyalty to different societies? It can get a lot. How do you keep it straight, and why do you serve all the societies?
so once again, for me, when I'm asked or offered to do something, so I always think about, am I the best person? So for example, I was asked to be on a board of something a couple of years ago, and I requested a phone call with the chair of the board, and I said, please let me know what you think I can offer, why you're asking me. Then please let me know what the commitment is. Okay. Because those are the two things I assess ahead of time. What are they looking for? Am I going to be a good person to do that? Or do I say, hey, I've got the perfect person for you, which happens 5, 10 times a day, frankly, for different things. I think, well, you know what? There's a different person who would do this better, because I want to uplift them. I want to get their name out, and I don't need to do it. There's something I have to do with my own hands or my own voice. And there are other things that there are people who I've been working with, trying to inspire and develop, that I pass it along to. So I never just say no. I always say, yes, let's talk about it, because if it's not me, I'm going to uplift somebody else. I think the second thing for me, though, is where I think I can either mentor, show people how, when things don't go right, because I'm a great example of, many things twisting and turning. And I know from an external perspective, it seems like, wow, this person has had such a good career. But truthfully, it's just a matter of making the best decision at each time point. And like the Japanese proverb, my barn having burned down, I can now see the moon. There are opportunities. I am very invested in the academy, other professional societies, because I want people who really care, like yourself, Dr. Shah, to be at the helm and to be thinking about, how are we going to build? What does our future look like? Who are our mentees? And just like AI, what do we need to learn to stay relevant and to stay at the tip of the spear?
As a final question,
Mhm.
are you as optimistic and as excited for the future of head and neck cancer as you were 18, 20, 25 years ago when you started on the journey, even as a 5 or 6-year-old looking at a facial tumor? Are you optimistic about the future of head and neck cancer? Think we've reached a plateau? Why don't you end with some of your futuristic thoughts about that?
The passion that I was fortunate enough to be imbued at the tender age of 5 or 6 continues. And I think people who know me know that I'm extremely, extremely driven in that area. And not because I want to compete. The only person I compete with, and I've always competed with, is myself. And I always think, Maie, you have a window into understanding something. What can you do about it? And how can you get people to join you? There's a fantastic quote from Simon Sinek in his book, The Infinite Game, that if you are on the road to win, you kind of go there, the crowd cheers for you, and then the game's over, and you may win. But if you're on the road to fulfillment, people will join you, there will be inspiration, and even after you're not playing in the game will continue. And it will continue and continue as we build the future. So for me, the passion, I don't think will ever die. I think my physical self will end far beyond my emotional and inspirational self. And I think with the advent of immunotherapy and with the advent of targeted therapy and with AI looking at potential matches for patients, we are really entering an era of what I would call precision surgery, precision treatment. And I'm so very humbled and inspired to be a part of it.
Well, thank you. This concludes our Voices of Otolaryngology with Dr. Maie St. I was so impressed the first time I heard her speak. The more I learn about her and see her journey, and even listening to us here for 40, 45 minutes, I'm so excited. Thank you so much, Dr. St. John.
Thank you, Dr. Shah. I really just want to tell you that in the short amount of time that I've known you and just, watching you build the academy, I had not met you prior to your role at the academy, and just really super impressed, super optimistic, and very excited to support you in any way I can.
Thank you so much.
Thank you. All right. Thanks so much.
We hope today's episode sparked some fresh ideas. If it resonated with you, please subscribe and share it with friends. Have thoughts or suggestions? Use the feedback form in the show notes. We'd love to hear from you. And don't forget to follow us on social media for highlights, behind-the-scenes content, and updates. Thanks for listening. See you next time.